Hello guys, now we'll discuss one of the long bone and which is situated lateral aspect of the forearm, which is the radius. അപ്പോൾ റേഡിയസിനെ പറ്റിയിട്ടാണ് നമ്മൾ ഇന്ന് ഡിസ്കസ് ചെയ്യാൻ പോകുന്നത്. അപ്പോൾ coming to the major features, that is, first of all, we are going to discuss about the major parts of the radius. It has mainly three parts, that is upper end, shaft, and lower end is there. Coming to the upper end, there is a head, neck, and a radial tuberosity is there. And the head is disc in shape, and the upper part of the head which articulates with the capitulum of the humerus. Coming to the shaft, shaft is the part which extends between the upper end and lower end. There is a lateral convexity is there, and also there is a sharp border, that is interosseous border on its medial aspect. Coming to the distal end, the shaft is much more wider than the upper part, and there is also concavity on the anterior aspect. Coming to the lower end, which is we already discussed that it is the widest part, and which has 5 surfaces, that is anterior surface, dorsal surface, medial surface, lateral surface, and an inferior surface is there. The major important features you have to look in the lower end is the towards the medial side, there is a medial groove is there, and towards the lateral aspect, there is a prominent projection, that is the styloid process, and towards the dorsal aspect, there is a palpable tubercle, that is a dorsal tubercle or the Lister's tubercle, which is the most important part which helps in the side determination. Coming to the anatomical position and side determination. Here, 4 features which helps in the side determination. First of all, we want to keep the bone in the vertical position and in such a way that the upper end, that is the disc-shaped head, should be directed upwards, and the convexity should be laterally, and the sharp border, that is the interosseous border, should be medially. Here, ഇപ്പം നമ്മൾ നോക്കുകയാണെങ്കിൽ ഇപ്പം നമ്മൾ ആ പറഞ്ഞ 3 points, that is head upwards ആയിരിക്കണം, കോൺവെക്സിറ്റി ലാറ്ററലി ആയിരിക്കണം, ഇന്ററോഷ്യസ് ബോർഡർ മീഡിയലി ആയിരിക്കണം. ഇപ്പൊ നമ്മൾ ഈ ബോണിനെ ഇങ്ങനെ പിടിച്ചാലും, ദാറ്റ് ഈസ് ലെഫ്റ്റ് സൈഡിൽ പിടിച്ചാലും നമ്മൾ പറഞ്ഞ ഫീച്ചേഴ്സ് എല്ലാം ശരിയാണ്. ഒന്ന് റൊട്ടേറ്റ് ചെയ്ത് റൈറ്റ് സൈഡിൽ പിടിച്ചാലും നമ്മൾ പറഞ്ഞ ഫീച്ചേഴ്സ് എല്ലാം ശരിയാണ്. ഇന്ററോഷ്യസ് ബോർഡർ മീഡിയലി, ആൻഡ് കോൺവെക്സിറ്റി ലാറ്ററലി, ആൻഡ് ഹെഡ് ഷുഡ് ബി അപ്വേർഡ്സ്. അപ്പൊ നമ്മൾ ഇങ്ങനെ രണ്ട് സൈഡിൽ പിടിച്ചാലും നമുക്ക് കൺഫ്യൂഷൻ ആവും, റൈറ്റ് ആണോ ലെഫ്റ്റ് ആണോ എന്ന് മനസ്സിലായില്ല. ഹെൻസ് ദ മോസ്റ്റ് ഇമ്പോർട്ടന്റ് ഫീച്ചർ വിച്ച് ഹെൽപ്സ് ഇൻ ദ സൈഡ് ഡിറ്റർമിനേഷൻ ഈസ് ദ ഡോർസൽ tubercle. We already discussed that towards the lower end there is a dorsal palpable tubercle, that is the dorsal tubercle or the tubercle Lister's tubercle, and which should be faced dorsally. As the name suggests, dorsal tubercle which should be faced dorsally. അപ്പോൾ ട്യൂബർക്കിളിനെ ഡോർസൽ ആയിട്ട് പിടിച്ചുകൊണ്ട് നമ്മൾ നോക്കുകയാണെങ്കിൽ ഒരൊറ്റ പൊസിഷനിൽ നമുക്കത് കിട്ടുള്ളൂ. കാരണം ഈ ലെഫ്റ്റ് ഹാൻഡിൽ പിടിച്ചാലും ട്യൂബർക്കിൾ ഡോർസലി വരണം, റൈറ്റ് ഹാൻഡിൽ നമ്മൾ പറഞ്ഞ പോലെ പിടിച്ചു കഴിഞ്ഞാൽ ട്യൂബർക്കിൾ ഫ്രണ്ടിലായിരിക്കും വരിക. അപ്പോൾ ഡോർസൽ ട്യൂബർക്കിൾ ഡോർസലി വരുന്ന രീതിയിൽ നമ്മൾ പിടിക്കുമ്പോൾ ഇറ്റ് ഷുഡ് ബി ലെഫ്റ്റിലായിരിക്കണം പിടിക്കേണ്ടത്. അപ്പോൾ hence we can say that it is a bone of the left sided, that is it's a left sided radius. Coming to the features and attachments, first we are going to deal with the upper part. Towards the upper part there is a disc shaped head, and this in a living body this head is covered with a articular hyaline cartilage, and above this head it articulates with the capitulum of the humerus to form the humerus radius articulation. And medially, the head articulates with the radial notch of ulna, which is seen in the ulna bone. This is the ulna bone, and the articulation is just like this. That is, this is the radial notch of ulna, and it articulates with the medial aspect of the head of the radius, just like this. Next, coming to the neck. Below the head, there is a constricted neck, and the medial aspect of the neck, there is the quadrate ligament is attached. Next, coming to the radial tuberosity. It is one of the most important part which will be kept for your spotters. And coming to the radial tuberosity, the biceps tendon is inserted to the posterior rough surface, and there is a small bursa in the anterior surface. This bursa covers this anterior surface and which separate the bone from the tendon of the biceps. Next, coming to the shaft. The shaft mainly consists of 3 borders and 3 surfaces. Which are the borders? There is an anterior border, there is a posterior border, and there is a prominent and sharp medial border or the interosseous border. Then coming to the anterior border, it starts below the anterolateral aspect of the radial tuberosity and it runs downwards, and above the anterior border there is the anterior oblique line which gives origin to the radial head of the flexor digitorum superficialis. Then coming to the posterior border. The posterior border is much more prominent only at the middle 1/3 of the shaft, and there is on the posterior border there is a posterior oblique line. Hence, anteriorly there is the anterior oblique line and posteriorly there is a posterior oblique line. And coming to the medial border. Medial border is also known as interosseous border. We already discussed that the interosseous border or the medial border is the sharpest border. And why it is called the interosseous border? The medial border is also called interosseous border because the interosseous membrane is attached to the medial border. Then coming to the surfaces, there are mainly three surfaces: anterior surface, posterior surface, and a lateral surface is there. Coming to the anterior surface is slightly concave and which is located between the anterior border and the medial border or the interosseous border. On the anterior surface, towards the upper 2/4, the flexor pollicis longus is originated, and towards the lower 1/4, there is the pronator quadrator is inserted. Coming to the posterior surface, which is located between the medial border and the posterior border. In the posterior surface, from the middle 1/3, the abductor pollicis longus arises, and towards the lower part, the extensor pollicis brevis is arises. Coming to the lateral surface is located between the posterior border and the anterior border. Then on the lateral surface, towards the upper 1/3, the supinator is inserted, and towards the rough area on the middle part of the surface, the pronator teres is inserted. Then coming to the lower end, we already know that it is the widest part and it consists of the 5 surfaces. The anterior surface consists of a thick ridge which gives attachment for the palmar radiocarpal ligament of the wrist joint. Coming to the posterior surface, there is a tubercle. We already discussed that there is the tubercle of Lister's is there, and which is located lateral to the groove for the extensor pollicis longus. Lateral to this Lister's tubercle, and there is a groove which is traversed by the tendon for the extensor carpi radialis brevis and extensor carpi radialis longus. And medial to the groove for the extensor pollicis longus, which is traversed by the tendon for extensor digitorum and extensor indicis. Coming to the medial surface, there is a medial groove. We already discussed that there is a medial groove, and this medial groove is known as the ulnar notch. And this ulnar notch provides articulation for the head of the ulna, just like this. It articulates with the head of the ulna. This is the head of the ulna. Complicated avanda idu nammal pinne padikkunnaayirikkum. Okay, this is the ulnar notch. Towards this lower margin of this ulnar notch, the articular disc of the inferior radio-ulnar joint is attached. Towards the lateral surface, there is a styloid process, and the styloid process is related to the abductor pollicis longus and extensor pollicis brevis. And the brachioradialis is inserted to the base of the styloid process, and the radial collateral ligament of the wrist joint is attached to the tip of the styloid process. Then coming to the fifth surface, that is the inferior surface. The inferior surface consists of the lateral triangular area and a medial quadrangular area. This lateral triangular area provide articulation for the scaphoid, and this medial quadrangular area is for the articulation with the lateral part of the lunate. Now we are going to deal with the clinical correlation related to the radius. As the femur in the lower leg, the radius is the weight-bearing bone of the forearm. Hence, the fracture of the radius is more important than that of the fracture of the ulna. Coming to the fracture of radius, there are mainly 3 sites. First one is, whenever there is a fracture occurring below the insertion of the biceps and above the insertion of the pronator teres, the upper part will be supinated by the supinator muscle, and the lower part will be pronated by the pronator teres. Second one is, whenever there is a fracture occurring at the distal end of the radius, the distal part will be displaced backwards and upwards, and this type of fracture is called Colles fracture. This is one of the most important clinical correlation of the radius. And this reversal of this Colles fracture is termed as Smith fracture. The fracture of the styloid process is also important when dealing with the fractures of the radius. Hope you guys understand everything about our bone and utilize this section as better as possible. Thank you.